Hi guys. How many in your group? Is everybody here?
Is 36 student.
Okay. Now it's supposed to be a lecture on developmental milestones, but actually developmental milestones is actually that big chart lah. So we're gonna start off just by going through the areas of development. So there's four, right? Gross motor, fine motor, and vision, social behavior, and play, and also what's the last one? Language, right? Okay, so after that, in between, we're gonna watch some videos, and then at the end of it, we'll do some videos on developmental assessment. Okay. Um, okay, so we'll start out with developmental milestones. Uh, so it's usually grouped into four categories. So there's gross motor, fine motor and vision, language and hearing. Then the last one will be social behavior and play. Don't need to take notes because basically this is basically the chart that you get in your pediatric protocol. Okay. So usually when we go by milestones, we go by certain ages. So 6 weeks, 3 months, 6 months, 9 months, 12 months, 18 months, 24 months, 36 months, 4 years and 5 years, okay, up to 5 years. Now, usually if you want to remember stuff, then it's important one would be in between 6 weeks and 6 months, 12 months, 18 months, 24, 36, and 4 and 5. So we're going to start off with primitive reflexes first. So this you get this in the babies, right? So involuntary motor responses, which originate in the brainstem, they are present after birth and early childhood development. They facilitate survival. So the important thing about this is that you need to remember that most of them disappear in the first year of life. If they persist after 6 months, then it's a cause of concern for the baby. There might be a neurodevelopmental problem in the baby. Okay. So what it means by it facilitates survival is like things like you have a sucking reflex, right? So sucking reflex is why? So that the baby knows how to drink milk from the mother, right? So examples would be sucking and rooting, palmar grasp, stepping reflex, asymmetric tonic neck reflex, Morrow's reflex, and plantar reflex. Plantar, the first 5 should disappear by about 6 to 9 months, right? So if it's still in the first year, so if it's still present after 6 months, then you're gonna have to be worried about it. So let's give me a second. Can you guys see the video?
Yes, we can see it.
Yes, you can.
So this would be the rooting reflex, right? That's the ANPR. So this is moral. So there's three components. There's abduction, then there's adduction, then there's the baby's cry. It must be symmetrical. Okay. Okay. Wait. Also another one about primitive reflexes.
At birth, children have a large number of reflexive behaviors. Reflexes are automatic, built-in responses to stimuli. Doctors and nurses assess a newborn by testing some of these reflexes. Often, reflexes are categorized in the following ways. Behaviors to help the infant respond to the environment. For example, when you stroke a newborn's cheek, the infant will turn to the side, enabling the infant to find a nipple. Sucking and swallowing reflexes enable an infant to take in nutrients. Behaviors that contain elements of later voluntary behaviors. These include the stepping, standing, crawling, and swimmer's reflexes. If an object is placed in the palm of an infant's hand, the grasping reflex will be triggered. Primitive defensive reactions. A reflex that is typically measured in newborn and well baby checkups is the Moro reflex.
Caveat, don't do the morals like this. Do the morals like the previous video. You understand? This lady holds both hands and then she lets go.
The Moro reflex. This startle reaction is a response. Checkups is the Moro. A reflex that is typically measured defensive reactions.
Don't do the morals this way.
That is typically measured in
do the morals like the previous video, right? Two hands, one hand supporting the baby's head and neck, the other hand slightly below, so that if the baby drops on your other hand. Got it now? Right? Do not pull both hands and then let go. Like this video. This is the wrong way to do morals. Okay?
Well, baby checkups is the Moro reflex. This startle reaction is a response to a sudden, intense noise or movement. When startled, the newborn arches her back, throws back her head, and flings out her arms and legs. Then she rapidly closes her arms and legs to the center of her body. Each reflex has its own developmental course starting at different gestational ages. Some reflexes persist throughout life, such as coughing, yawning, and blinking reflexes. Other reflexes disappear, typically between 3 and 6 months. It is believed that as the development of the brain progresses, voluntary movements take over and the reflexes are suppressed. Doctors continue to assess these reflexes during routine well baby checkups to make sure that particular reflexes disappear as scheduled. This tells us that the infant's nervous system is developing normally.
Okay, this last bit is just morals.
Hello everyone, welcome to Pediatrics by Dr. Anand, and today's topic of choice is neonatology, and you can see some wonderful reflex over here.
So when you do morals, always remember to support the baby at the back, so that you don't flop the baby right onto the bed, right? If you can do it with two hands, if you cannot do it with one hand like him, usually what I do is I do two hands. So one hand would be like here, right? And another hand would be under the other hand, further away, nearer on the bed. Got it? So that when you let go, the baby will fall onto your hand.
Here, any idea what is this reflex showing the baby? When I'm suspending the head of the baby, something is happening. Baby is opening hands and kind of crying. What is this? What is this reflex? It is nothing but Muru reflex. Okay, that is the first point. Very important Muru reflex you need to know. So this is a very basic question they ask you in NEET PG also and in MBBS also everywhere. So point number one, what are the components of Muru reflex? Number one, when you suspend the head of the baby down, what happens? There is a symmetric, very important, symmetric abduction and extension of the upper limbs. Number one, with opening of the hands. Can you see the opening of the hands? Yes or no? Yes, this one, this one. Did you see that? I'll repeat again. The components of Murus are number one, symmetric abduction and extension of upper limbs with opening of the hands followed by flexion and adduction, and the third is that the baby cries. So these are the basic important components of Murus. I'll repeat again. The Muru reflex have number one, symmetric abduction and extension of the upper limbs, yes or no, then opening of the hands, then this followed by flexion and adduction, and the baby cries. These are the components of Muru. PG entrance question number 2, when what is the onset of the Murus, and when does the Murus fully develop, and when does Muru disappears? Okay.
Okay. So those are the reflexes. Yeah. Yeah. Tak dengar.
Your voice is not clear.
My voice is not clear. Yeah. Better now. Better now.
Okay.
So those were the reflexes I was saying just now. Got 3 videos, right? The second video, the way the lady was doing the morals is not very correct lah. You basically don't pull just 2 hands and then let the baby go like that. Okay, you can hurt the baby. Also, when you pull 2 hands up like that, you can't, and you let go, you want to see the symmetric abduction of both upper limbs, isn't it? So you can't really see it very well because you're basically obstructing it by holding the baby. So what you do is like the first one or the last one, you support the baby's head behind and then just let the baby fall onto the soft surface. Okay. So the importance of this primitive reflexes is that they should be gone by about 6 months or so. So if a bigger child, 1 year old, still has all this, then maybe it's a sign of a neurodevelopmental problem. Now we're going to go into developmental milestones. We're going to break down each area. So the 4 areas: gross motor, fine motor, social, and then language. Just briefly look at some red flags. And then just very briefly causes of developmental delay. Also, we are going to go through a review of the developmental assessment. So gross motor development, it develops in head to toe order. So basically, it makes sense, right? When a baby needs, when you're learning to walk, first you need to be able to control your head, then your neck, then your trunk, then you sit, then you pull yourself to stand, then you walk, then you run, isn't it? It's a progression. So the main ones are here. So 6 weeks, there's symmetrical movement and tone. 3 months, lift head and shoulders off the floor in prone position. Little to no head lag or pull to sit. 6 months, head control should be complete. 9 months, sit unsupported. 12 months, walking should begin, or at least the child should be able to sit alone on their own and cruise. 18 months, walking should be accomplished. So any kid who cannot walk unsupported by 18 months needs to see a pediatrician. 24 months, so more advanced movement. This is when they usually run. Okay, start to climb the stairs, but not the normal type of stair climbing that we get lah. Sometimes 2 feet at a time usually. 36 months, normal stair climbing. 4 years, they start to hop. 5 years, hop and skip, jump 2 feet, kick the ball. Okay. Now, after that, we fine motor and vision. So fine motor and vision goes together because basically, like if you want to pick up something small or you want to build a tower, you also need to be able to see at the same time. So you assess them together and play and make it fun for the child. The list is here. So 6 weeks, 6 and follows. 3 months, notices own hands. 3 to 4 months, basically. 4-month reaches and grasp, usually there's a palmar grasp there. 6-month palmar grasp, they transfer hand to hand a bit later, about 7 months. 9 months, they have a pincer. 12 months, they have mature pincer. Object permanence, meaning if he drops something, he look for it. That means he knows that the object is there without the need for him to actually see it. So usually what we do is that we play with a toy, let the kid play with a toy, and we take the toy and we hide it under a pillow or under a blanket. The child should know that the object is now under the blanket, and usually they'll pull up the blanket and look at the object. We start to point. 18 months, scribble spontaneously. Tower of 3. 24 months, tower of 6. 36 months, tower of 9. Imitates a bridge. 4 years, 6 block steps. 5 years, 10 block steps. Now, when we assess, when you're a bit older, about 18 months or so, you can assess fine motor by drawing. So usually this is scribbling, then you proceed to lines and shapes. And there's also something you call good enough draw or person test, which psychologists also use to determine psychological profiles. But anyway. So scribbling, first they'll start with back and forth scribbles with an immature grip. Then after that, we modeling with genuine scribbling. What I mean is this. What I mean is this. So first, when the child is about 1 year plus, they start to scribble. About 18 months or 18 months, they start to scribble. So this is what you call immature grip. They hold the pen like that first. All right. So what they do is up and down like that. So that's what they do lah. Okay. Then after that, then they scribble a bit more properly. So nearer to about 2 years old, and what they start to do is they might hold it like that. And then they scribble lah. Just scribble. You can see that they're scribbling more nicer and then with better shapes, right? But this is not the circle that you test when you test for 3 years old. This is just generally just scribbling. Okay? Then okay. So these are the shapes that they can draw. So there's 2 years, usually it's just a straight line. 3 years will be a circle. 3.5 years will be a cross. 4 years will be a square. Then a triangle and a diamond. Usually what I do when I learn developmental milestones is that I learn the progressions first. So I don't learn like 2 years, do this, 3 years, do this, 3.5 years, do this. What I learn is that when they learn to draw, they start off with the line, then the circle, then the cross, then the square, then the triangle, then the diamond. Then only I put on I tag on the years to the pictures. So if the child is able to draw a circle, I already know that the child should be able to draw straight lines, right? So when I assess, I don't need to ask him to draw a straight line anymore. I just straight away go up and ask him to draw a cross and then a square. Right? Same thing also lah. If you are starting off and the child is already drawing a nice square for you with a nice house, then you know you don't need to go back and test for a circle because it's already a given that the child most likely can draw a circle. These are the cubes. Roughly, they start to stack cubes at about 18 months. So what I remember is there's 3, 6, 9, right? So 18 months will be 3. 2 years will be 6. 3 years old will be 9. Right? Then 3 years old will be the bridge. This is the bridge. Make sure that there's a hole in between the bottom 2 blocks. So when you do it, when you show it, sometimes what I do is that I say, look, this is a bridge, and then a car can go through, so that the kid knows that he needs a little gap in between the bottom blocks. This is a good enough test, but basically this is what a 3-year-old will draw. This is what a 4-year-old will draw. Now, this is how they start off holding the pen. So that's the palma. Then they do the extended fingers. And then this is basically how we do it, adults do it. Okay, next we go to language and hearing. It might be easy you get a friendly patient, but if you get a shy patient, then it's better to get the parents to help out. Okay, roughly 6 weeks skills comes to sounds, 6 months turn to some babbles, 12 months first words response to name. This is when you can do the distraction test. Distraction test is you can actually do when the child is about 9 months old. Basically, you need two people, one person in front and another person at the back. So the person in front is the person who's going to look for a positive response or not, right? So the person in front will play with the child, okay? And then the person behind will hold a bell, right? And then they'll ring the bell behind the child, either to the right or to the left. So while the child is distracted by the person in front, the person behind will just either ring on the right or on the left. So a positive one is when the child will turn towards the sound. A negative is when ring, 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 the child doesn't do anything. Okay. So 18 months should have at least more than 5 words, about 6 to 20. Follow simple instructions. Put the car, give the car to mommy. Open the book. Okay. 24 months, 2 years old must have 2-word sentences. Okay. 36 months counts to 10, 2 colors, understands on, in, and under. 4 years more fluent conversation. So basically, this one also I learned by progression. So what you do is that for colors, you remember that they learn the primary colors first, then the secondary colors. So usually what they know is that they know yellow, red, and blue first. Then only they'll know red, green, orange, and purple. The last will be black and white. Okay, so if the child can recognize like green and orange, then most likely the child can already knows red, blue, and yellow. Right? Prepositions on, in, under. After that, you'll learn about in front and behind. The last one will be in between. Okay, so if the child knows what in between is when you're assessing, then most likely she already knows what on, in, and under is. So if you don't have enough time during a developmental assessment, that's basically how you know and how to place the child also. Social behavior is more difficult to assess. Some kids may not want to play with you, but this is when you ask the parents to help out, and then just play with the patient. So 6 weeks smiles, 6 months laugh and squeals, 12 months waves, do us a peekaboo, drink from cup, 18 months spoon feeding, 24 months, 2 years old starts toilet training, dry by day, remove coat, parallel play. Parallel play, that means they play next to another kid, but they don't play together with the kid. So the 6 months they start to share, make believe play. So the make believe play will be more complex, right? So they can start substitution. So what I mean by substitution, that initially when you play with cars, right, the car goes boom, boom, boom. So you start, the child that starts to do that about 2 years old, boom, boom, boom. After that, as they progress, they can do substitution. So basically, instead of a car, they have a box. So they can imagine that the box is the car. So they're using the box as a car. So they go, this is a car, boom, 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 boom. Okay, 48 months creative play, taking turns and so dress yourself. Now, the important things here would be smiling, parallel play, make believe play. Now, red flags. Red flags is when a child doesn't do something by a certain time, he or she will need evaluation. Now, this includes patients who plateau, meaning they develop normally up to a certain point, and then after that, they are just stagnant. So maybe they were starting to talk, right? So they got about 10 words. Then after that, they stop talking. They stop learning new words and they just plateau. Okay. Regression is also very important. If a child regresses, it's mostly it's almost 100% pathological. So you must make sure pay attention to these kids and get a proper evaluation. So regression would be like learning to talk, got 10 words, got 15 words ready. After that, totally don't talk at all. Or already able to walk and run, then suddenly cannot run anymore. When they walk, they are very clumsy. So that is regression. So if at birth, the moral reflex is asymmetric, that means only one side, that's a red flag. If they fail their hearing assessment, that's also a red flag. At 3 months, if the child has no head control and no smile, okay, these are red flags. I mean, if this happens at this age, then you need to evaluate the baby. At 6 months, if there's still primitive reflexes, distinct. If there's early hand preference comes by only after about 2 years of age. So if they have very early on, they already prefer one side, maybe or just the right side or the left side, then you're gonna be worried about a neuromuscular problem, or maybe the child had a neonatal stroke, right? So only one side. When the child has minimal response to people and noise, so deafness, autism spectrum disorder. 9 months if the child is not weight bearing. 12 months if the child is not sitting with no words. 18 months if it's not walking, it's mouthing or drooling. 24 months if there's less than 5 words, the child is not interactive. Obviously, you're going through autism spectrum disorder, right? 36 months if the child is not interactive, no 2 word phrases. If 5 years, usually the teacher would report back. This is when you start to pick up the children with learning disabilities. Okay. Now, causes of developmental delay, this is not a comprehensive list. This is just like a very, very rough list. But if you have isolated all global developmental delay, some of the causes might be abuse, malnutrition, things like cerebral palsy. In PEDS, you have obviously PEDS, IEM, inherited disorders, things like Duchenne muscular dystrophy, spinal muscular atrophy, that would be gross motor delay. You get syndromes like Down syndrome, right? Structural abnormalities of the brain, right? If the child is already going to school, got slow school progress, it might be something as simple as just a hearing or visual impairment. A child doesn't need to be totally deaf in order to have delayed speech, or having difficulty concentrating in class. Just a little bit is enough already. If the child has specific learning difficulties. So children with poor social skills, you might think of autism spectrum disorder, or in some cases also ADHD, attention deficit hyperactivity disorder. Now, this is not the best way to learn development. Usually, the better way would be for you to get a paper, because it's all words, right? Right now it's just all words. You have your pediatric protocol review or your Lisauer book. Okay, you just open to the page to development. Now, because it's all words, it's very difficult. I actually tried to do something, but I am old and hopeless at editing videos, so we ended up with this. But basically, you're going to see 2 Chan regions.
Yeah.
Okay, basically what you can do is that, give me a second. Okay, so basically what you can do is that you can just get a piece of paper, draw a line, all right? So what you can do is that just put on the main months involved. So 0, 3, 0 months, 6 weeks, 3 months, 6 months, 9 months, 12 months, 18 months. Obviously, it's not proportionate lah. But these are the important milestones. So 0, 3, 6, 9, 12, 18, 24, 36, 48, 60, right? So what you do is that you start with gross motor, then head control. 6 months, you know there's no head lag, they start to sit. 9 months, they start to tripod sit. Tripod sit means they sit like this with a triangle at the base, right? So tripod sitting. And then 12 months, they start to cruise, start to walk. 18 months walks well. So 24 months run. 36 months tricycle. So that's easy to remember because tricycle 3 years old, right? 48 months, 4 years old, hop, skips, and it goes on. So then you do with fine vision, motor and vision, fix and follow, hand regard, Then the drawings are there. Then after that, you continue with social and continue with language. So if you have a timeline, it's easier for you to study rather than just looking at the words and looking at the chart. That's the way I would do it lah. Got it? Whoops. Sorry, feedback. Got it? Right? So I would draw a timeline. That will be so much easier to remember rather than looking at a chart. Right? Okay, so after this, we're going to go through development. Anything you guys want to ask now? It's basically just studying and reading your chart. All of these takes practice lah. The more patience you do, you see, the better you get at it. Even not patience also, if your brothers and sisters, nephews and nieces, just play with them. Take note of the age, and then if you get used to what's normal, you know what's abnormal, basically. Right? Anything you want to ask now before I go on to developmental assessment?
Doctor, I have a question. So for the red flags, okay, can you hear me?
Don't have to go developmental assessment. Developmental assessment is just videos because of that lah. Okay. So developmental assessment usually it's you can do it. Okay, if you're talking purely from an exam point of view, right? Then either we give you a kid, tell you the kid's age, and ask you whether the kid is appropriate for age or not. All right. So say this child is 3 years old, can you assess his developmental milestones and tell me whether he's appropriate for age? Okay. Or we could give you a child, don't give you the age, and ask you to guess the age. All right. Usually these are like, you say this child was premature, can you just assess his developmental milestones and give a roughly and what age he corresponds to, right? Most of the time, you don't assess all at once because assessing all at once is very difficult. So usually it's like gross motor and fine motor, right? Or fine motor and speech or just speech, right? Social very difficult because if it's an OSCE kind of thing, you guys get OSCEs right nowadays. You cannot assess social in 10 minutes, okay? And then we'll just watch videos. How you do it depends on how young the kid is, and also depends on how delayed the kid is. If the kid is very young, a baby, basically there's not much you can do. You just do the head control, frontal control, put him prone, look at his, mainly it's just gross motor lah. If the child is toddler age, then depending on how playful the child is, you have to go with the flow. So if the kid wants to play with blocks, then you start off with blocks first, rather than asking the kid to jump up and down, squat down, scroll or whatever it is, right? If the kid decided he doesn't want your blocks, he just wants to play, wants to start scribbling, then you go along with it, like you scribble but with purpose, right? So you play along with purpose, scribble while he's scribbling, you try to get him to do all the shapes, right? In between, if you are offering toys to the patient, after you're finished with each task, take away the toy, hide it away, then only take out the other toy. Because if you leave too many toys at the same time, what will happen? The kid gets distracted, right? And may not want to do whatever it is you're doing. So you cannot go on your assessment. Okay, so so this is a baby's one first, okay?
Okay, Lara, welcome to your developmental assessment. This is Raphael, and I'd like you to examine all 4 domains of his development, please.
Okay. Hello, my name's Lara. I'm one of the doctors. Is it all right to examine Raphael's development today? Can we actually just pop him down here and try and sit, just because we've got a few toys and things to play with? Hello. Hello. Hey. Is he able to sit if you support him? Yeah. Yeah, should we do that? Do you want to? Hello.
Come on, Mr. Cousin.
Oh, actually, no, just while he's there, we'll have a look. Have a look. Hello. Well done. Well done. Was that a smile? Clever. You are a very clever boy, aren't you? Yes. Yes, you are. That's very clever indeed. Now then, yeah, would you like to sit him up with support? That would be great.
Can I sit where you are?
Yeah, shall we swap sides? That's okay, fun. Does he roll?
Yeah, he rolls.
He does roll.
But do you want to say that
Perfect.
first?
Not necessarily, that's absolutely fine.
And he's going from his back to his side as well.
Okay. That's it. Yeah, so if you sit him up, I just want to see what he's like playing with these. There you go. Now then. What's this? Would you mind just turning him so he's facing me? Thank you. What's this? What's this? Hey? Would you like to hold that? Well, what about this? This one might be a bit big, I think. I know. Would you like to hold these for me?
I'm holding your arms, baby.
What's this? You're looking, aren't you? Yes.
It's still dress.
Do you think the patterns?
The black and white.
Hey? No?
It's not bothered with hers, really.
How about this? Is that easier for you to hold? What's this? What's this? Okay. All right. Now then. Hey? What's that? Lovely. Okay. Can we just stand you up? Let's just see what you do. Let's have a look at your toe. Yes. You step on me. Well done. Oh, well done. That's really good. Really good. Now I'm going to do tummy time now. Have a look that way. That's a lovely head control, isn't it? That's all right. Does he like being on his tongue?
Yeah, he loves
I'll
it.
just move these out the way. Let's have a look. Oh, there. Let's pop you this way. You can have some tummy time. Put your arms out for me. Yes.
Come on, over you go.
Fantastic.
He's trying to go over.
He's got nice head control there, and he's weight control on his forearms. You're gonna.
So that's about 3 months, 4 months old when you have the head. You see, he's able to lift up the head and then he's propping his upper body on his upper limb.
Do a roll for us? Maybe.
Got too much clothes on.
That's all right.
He's just in a baby dress.
Oh. Hey. Should we go back? Hey, should we go back to Mum? That's fine. You want to pick him up and bring him back? Lovely.
Big boy, he did well.
Okay.
Do you want to see his tummy time? If I strip him down, he can do it.
No, that's absolutely fine. Just a couple of questions for you. Have you had any concerns about his vision or hearing at all?
No.
No. And was he born early?
Yes,
or?
11 weeks early.
Okay. All right.
And they AOK'd his eyes and his ears. And
Good. So he's had
MRI.
all the checks and everything. Perfect.
He's just
Okay.
not really interested in toys, he's interested in people.
Yeah. No, that's fine. Do you see him pick objects up?
Yeah,
When
he
you're
was
at
just
home?
sitting in the pram
Yeah.
playing with that thing. He holds his, I've got a little set of keys.
And he
Plastic
likes
keys,
that.
he likes those.
Yeah.
He
Okay.
grabs toys all the time actually. But
Good.
if he's around new people,
Yeah. No, that's
He's more
fine. He's not
interested
just
in
not
the
very
people.
interested in these ones, are you? What's this? Hey, what's this?
isn't it?
You want to show us? Have you seen him pass objects from side to side yet?
Yeah.
Yeah.
Bigger ones than that though.
Yeah. That's
And
all
two
right.
hands.
Oh, Hannah might be going to bring us some extra. There
This
we
he
go.
loves.
Do you like? Should we play with
This he
this? You show me.
Shall I lay him down and do it? Or
Yeah.
sitting up?
Yeah, whatever you
'Cause
think is.
When he's sitting up, he's concentrating on sitting. It's that dress. I've got black and white toys.
I'm glad you like my dress. Fantastic.
Put this in the pan, won't
So
they?
he's lovely and awake and alert, and he's smiling well, not yet showing any strange or anxiety from a social point of view. Yes, that's fantastic. And from a fine motor point of view, Mum report. Oh, you're feeling right. He's got a nice grasp of my finger there. It's a palmar grasp. Yes. Yes. So that would put him at 3 to 4 months. By 6 months, I'd want to see him transferring. I haven't yet seen that today. No.
By 6 months, you wanted to see him transferring objects from side to
So I'm
side.
talking about, yeah, so when you mentioned that he can do that, so that's something that we would see at around about 6 months.
Right, okay.
Obviously a little bit more complicated because he was born early. So as you know, we would correct for that.
So really,
Yes.
it's 3 months.
So actually that's a question I don't know if I'm allowed to ask. How old he is. How old is he actually now in terms of his birthday?
In terms of when he was born, he's
Yes.
5 months.
So he's 5 months.
He was
But he
born
will
on
be
December the 27th. He was due on the 30th of March.
perfect. Okay.
So he's more like 3 months.
In the terms of corrected, yeah. So at that age, really, we'd expect them to be showing the palmar grasp, which you saw,
Yeah.
and then picking up objects, but not necessarily passing them across.
Okay.
So that's really good if he's doing that. And again, that would be consistent with that he's rolling, but not sitting yet independently, because too soon for that.
He did for 9 seconds the other day.
Lovely. And he's got a lovely fix and follow, and he's responding to sound. I don't think there's anything else that I would need to do at the moment. So today I've examined Rafi, looking at his development. He looks well grown but I like to plot him on a growth chart for his head circumference, length and weight. Mum reports that he is currently 5 months of age, but he was born 11 weeks early. So he's around about 3 months to 3 months corrected. From a gross motor point of view, he can not yet sit independently, but does sit with support. He's able to roll, and he has good head control. So that would put him at around the age of 3 to 4 months. By 6 months, I would like to see him perhaps sitting without support. From a fine motor point of view, he fixes and follows well, and he has a good palmar grasp. Mum reports actually that he does transfer, so that would put him at around 6 months. We haven't demonstrated that today, so based on what I've seen today, he would be at around the age of 3 to 4 months.
From a social point of view, he smiles beautifully, and he doesn't yet display strange anxiety. So again, that would be consistent with the same developmental age. And from a hearing and language point of view, he responds to sound, turning his head appropriately, and makes cooing noises, which again would be consistent with a developmental age of around 3 to 4 months. So he's behaving exactly and appropriately as I would expect.
Okay, so that is for a baby. Not much you can do, right? So basically just head control, frontal control, not much. So if you go on to a 8 or 9 months old.
Hello.
Hi.
Hi, this must be Ben, is
This
that
is
right?
Ben,
Hello,
yes.
and are you Ben's mum and dad?
Yes, we are.
Okay. My name's Emma, I'm one of the doctors.
Hi.
And I've been asked to have a look at Ben's development. Is that okay with
Thank
you
you,
today?
yeah.
Are you aware of Ben having any pain at the moment? Is there anything that I would do that would cause him pain that I
No.
should
No.
avoid? Okay,
No.
good. So I'm just going to see what you've brought with you today. So just ignore not lucky. Okay. Hello, Poppet. Hello. You're with Mummy. Shall we see what you can do today? And then perhaps I can ask you a few questions
Of
as we
course.
go along as well. Hello. Happy there with Mummy, aren't you? Good boy. There we go. Oh, and into your mouth. Well done. Can you manage another one? What do you do if I offer you a second one? That one's gone. So he didn't seem to look for that when he dropped it, suggesting he might not have object permanence.
So this is what I was talking about object permanence, right? If he has object permanence and the thing dropped, he would have looked down and to look for the block that had dropped.
Good boy. You take it with this one. Have you had any concerns about his vision at all?
No.
Or hearing? Did he pass his newborn hearing?
He did pass, yeah, no problems
Okay,
with him.
good boy. Okay, so he's put that to his mouth again. Will you take a second one? Okay, good boy. Well done. Okay. And then I'm just going to offer him something tiny and see. Hold on to that. Hold on to that. Good boy. Okay, good boy. Well done. You're playing with us very well, aren't you? That's going to go in your mouth as well. Okay, I think I'll borrow that one. And then we might see what you'll do if we put you on the blanket. Shall we see what you do down there?
Okay.
Good boy. So, if you lie him down on his back, we'll see what he'll do. Oh, shall we lie you down next to Mummy? There we go. Oh, he doesn't like being on his back. Is that right?
He's okay.
Is he okay?
Yeah.
You're lifting up your feet. Does he roll either way? That's what I'm trying to see if he'll do, but he may
does-
not demonstrate it for us.
He does both ways.
He does both
a lot.
ways.
Yeah.
Well done. Are you very roly?
So when you roll, they learn to roll prone to supine first, then supine to prone. So how I remember is P, prone is P, then S. So about 6 months prone to supine, 7 months supine to prone. Okay.
You're very roly. Okay. And let's see what happens if we sit you up a little bit, shall we? Oh, are you going to show us? Yes.
Get my
Good
knees
boy.
out of the way.
Oh. Okay.
There's more space this way.
What have we got over here? Good boy. Okay, so he is showing us that with a bit more time, and as you said, oh, there we go. What are you going to do down there? Hello, your front. There we go. Very good. What about those? So you're lifting yourself up a bit. Well done. And back round again. Okay. Good. Well done. So I'm just going to see what he does if I pull him up to sit, okay? I'm going to support him. Just check his head's
When you look for
okay.
head contact,
Oh,
you look
you're really wiggly. Okay, good boy. Ooh. There we go. Should we make sure you're in the camera? The film star. Good boy. Okay, so he's got quite a curved back when he sits.
Yes.
And he doesn't sit without support?
No.
Okay. All right, let's stand you up. See if you'll take some weight on those feet. Good boy. Okay. Very good. That's very good. Well done. Okay. What's his happiest position when he's on the floor? Where would you like me to put him?
He's happy just
on
rolling
front?
around front
Okay.
or back, really.
Let's put you on your back again.
He started sleeping on his front recently.
Good boy. Well done. And then if I can find a red brick, we'll just formally test his vision. If we can. What have I got here? Too happy rolling around, okay, but you've told me you don't have any concern.
About the vision?
No.
No, none.
And in terms of feeding, what does he feed at the moment? Is he still on just milk, or does he take some?
Started on solids
Yeah.
a couple of months ago.
Hello.
So he's moved on to textured lumpy things, beginning to finger feed.
That was my next question. So he finger feeds,
Yeah.
but certainly no spoons yet.
He grabs it.
Does
He
he?
does try. I mean,
Okay.
and sometimes it will go in.
Okay, so he tries with a
Yeah.
spoon. And have you noticed, I haven't noticed that he prefers one hand over the other today, but at home, have you noticed him using one hand?
Not really, no.
Okay, very good. Very good. And with strangers, he hasn't seemed too frightened today, but has he developed a fear of strangers yet?
No.
No, not
Okay, no, that's good. Okay, and he's doing a little bit of chatting for us now. Do you think that he understands the word no yet?
I'm not sure. I think he might do. Oh, he said yes. I think he might. I have not really thought about it, but
Yeah.
yes, I think.
Perfect, aren't you?
I think maybe you do.
Good boy. And do you
I'm
feel
gonna
that he
try and-
knows his name?
Not sure if he knows his name.
No, that's okay. And in terms of his babbling, is what we heard just now quite typical, or does he do anything different at home? Making different noises?
He's got a fair repertoire,
Does
hasn't
he?
he, of different sounds, but not any distinct kind of.
Do you notice him? It sounds like a funny question, but do you ever notice him use consonants as well as vowels?
Yes, he
Because
does.
most of what we've just heard is vowels.
Yeah,
but he
no,
does-
there are M's and G's and
Okay,
B's.
good.
Yeah.
Any formed words yet?
No.
Okay, that's fine. Very good. Good boy. That's brilliant. Thank you very much. You've been so good since it's the end of the day. Thank you very much.
Okay. So that would be a kid who's roughly about 8 months or so, about 6 to 9 months, right? The child has achondroplasia, so sometimes they can have a little bit of developmental delay, especially if they also have hydrocephalus at the same time. Those questions they were asking, does he understand yes or no? Typically a baby who is about 1 year old, he should be able to understand yes or no. Does he know his name? That's about 2 years old, right? Okay. When a child rolls over, they start to roll over about 6 months. So you roll P to S, prone to supine first, then me supine to prone. Okay, those are some more things for you to remember. Two more videos. Roughly about 2-year-old girl, and another one also roughly about 2-year-old girl. But one is where the candidate is more flexible, and another one is where the patient is a bit too playful and refuses to do anything. Okay, so you can see how difficult this is once you reach toddler age. Then after that we're done.
Hello Gary.
Hi.
This is your development station.
Okay.
Please could you examine Bassimat? I'd like you to examine her speech and language development and her fine motor development.
Sure. Hi, Bassimat. Hello. Is that your mummy? Hiya, Mum. Gary's my name. Is it okay if I test Bassimat's development today? Thank you very much. Do you want to play a game? Yes. Yes, of course you do. Okay, I'm going to ask you some funny questions. We put these here. Oh, and thank you. I nearly forgot about that bag. So, can you point to where your mummy is? Oh yeah, thank you. I forgot my car. So, can you show me where your mummy is? Where is she? Can you show me where she is? Can you point at her? Where is she? Where's your mummy? Where's Bassimat? Do you want to play a game? Come on over here and we play a game. Okay. Can you tell me which one? Can you tell me which one is the duck? Where's the duck? Oh, well done. You're very good at this game, you know that? Can I see the duck? No. Can you hand the duck to me, please? Oh, thank you. You're very good. And can I have those back? Pretty please. I'll give you a brick if you give me all those back. Thank you. And the duck. Well done. And which one is the spoon? Which one of these is a spoon? Well done. And can I see that? Okay. So which one of these do you eat with? Which one? Ooh. Bassimat? Do you want to finish the game, Bassimat? Yes. Oh, thank you. Which one of these do you eat with? Oh, well done. You're very good at that. Wow. Okay. Bassimat, we're not finished our game. Do you want to come back and finish the game? Come on. Come on then. Oh, well done. Okay. Bassimat. Oh, she's very, very good. Okay, I think what we do is I'm going to move on to fine motor. Okay, let's play some games. Here, Bassimat. Look at these bricks. Look. Look at the bricks. Oh, can you show me? Can you show me how to build a big tower? Oh, I knocked it over. You show me how you build it. Close. Nearly. Go on, show me. Come on, you want to win. Well done. That's it. Well done. All right, showing off now. That's it. So, 6 bricks. Wow. And Bassimat, can you do this? What? What's on it? Oh no. We leave that alone. That's hiding. It's asleep. You have to leave it asleep. Can you build a bridge? Can you? Like this. Look. Oh, can you do that? Oh, wow. You're very good at that. And now, Bassimat, look. Oh, look at this. Look at this. Can you draw me a picture? Can you? Look here. Can you draw any pictures? Can you draw a picture? Yes. Go on. Oh, no, that's eating it. Is that nice? That tastes funny. Yuck. You. Can you draw any pictures? Can you do that? Can you do that?
Okay. That's it. And can you do this? Oh, very good. You're very good at that. Yes, well done. Okie dokie. And then... What did you find? What did you find? Basimat? Might be too small. Do you want to see my snail? Yeah. Come on over here and have a look at this. Look at this. Oh, what's that? Can you see this? Can you do that? Can you get that in there like that and go? Can you do that? What do you think? I think I'll present my findings now, if that's okay. Thank you. Now you can have all the toys.
Would you like to present your findings?
Sure. So today I examined Basimat, who is a very playful little girl. I'd like to plot her height, weight and head circumference on the appropriate growth chart. And today I examined her from a fine motor and speech and language point of view. With regards to her speech and language, she was able to understand when I gave instructions. She was able to understand my language. She was forming 2 to 3 word sentences. When asked, she was able to understand nouns. She was also able to understand verbs. The examination got a bit difficult at that stage, but I would have liked to check if she was able to understand prepositions or adjectives, just to push her to her limit. But from that viewpoint, she was able to show a speech and language age of 18 months. In regards to her fine motor, she had a very delicate pincer grip, which she demonstrated when she grabbed the crayon. She was able to build a 6-block tower. She was unable to demonstrate today a bridge, but she was able to show crisscross lines. This would put her developmental age with regards to her fine motor at around 18 months to 24 months. I would have liked to push her a bit further to see if she could have built a train, and I also would have liked to see how she would have done with much larger beads. So I just didn't have at my disposal today.
If I tell you that Basimat's 2 years old, what would you explain to her mother?
I would explain to her mother that I'm not concerned about her her overall development, but I would like to assess her again to see how far I could actually push her, because I think that today she's just been very playful and hyper, and I don't think that was a true reflection of how far she could actually do.
And are there any other questions you would like to ask her mum, or assessments you think would be relevant?
Yes, so with regards to her speech and language, I'd like to first of all know, was she born on time, if she was premature? I'd like to know if there's any neonatal complications, and then I would also like to find out how her audiology examinations were at the time of discharge from the hospital. With regards to her fine motor, I'd like to know if she has any visual problems, which I didn't elicit today, and also would like to know how she gets on at home with regards to mum. Thank you. With regards to mum giving instructions and how she does with her utensils at home with eating and drinking and that.
Thank you.
Thank you.
So if you get a happy kid like that, who's very, very playful, it's a bit more difficult, isn't it? Right? So you notice that you really do need to only present one thing at one time. Even when the candidate tried to hide it, she still went and dig for it, isn't it? Try to do one thing at one time, and then you have to go with the flow. The kid wants to play the blocks, okay, fine, you do the blocks is still fine motor, isn't it? Right? And draw. You could see that hers wasn't this yet. It still was still this, which was appropriate period for a 2-year-old, isn't it? Right? Speech. A lot of times she was spontaneously talking. Understands, yes, understands, no. She was making 2 to 3 word sentences. So a lot of your developmental assessment is actually a lot of it is just observation. play as much as you can, but play with a purpose. Don't like simply play lah, right? This child is harder. I should have shown the easier one first before I show the harder one. But you imagine you get a happy kid like this who likes to play around during exams. I think you'll be panicked, basically. That's it. Do you want to watch another one, or do you want to wrap up? No answer.
Watch another one.
Watch another one.
Yeah.
Around the same age or older, or anything specific?
Maybe older, if possible.
Older you cannot too, because usually what happens is that you can get patients up to the developmental age of 5 years old, right? So if somebody is older, most of the time you get the age range of somebody between either their ex-prem about 9 to 12 months old, or you get a slightly older one like that girl just now, Nasima just now. Let's see whether you have an older one. I don't think you have an older one. Let me check. Okay, this is older, but it's speech and language, not quite fine motor. But anyway.
This is your development station.
Okay.
I'd like you to assess the speech and language development of Daniela.
Okay. Daniela, hello. Hello. What do you do with that? Are you going to sing a song for us? How are you doing today, Daniela? What's this? Come, look what I've got. What is this? What's that? What does it do? Quack, quack. What does it do? What is it? Okay. Shall we sing a song, Daniela? Do you want to show me where you... Okay, let's start. Before we do that, let's put this away. You've got your foot around it. Shall we sing a song? Come. Okay, come this way. Daniela, come. What have we got here? What?
Sorry, I clicked on the wrong one. Yeah. Never mind. This is speech and language. What do you guys notice so far? Somebody give me an answer. Ashraf, what do you notice so far? Ashraf, what do you notice so far?
Notice what? About the
kid, yeah. So far, what have you noticed? By size, she looks like roughly about 2 years old, right? By size lah, right? Roughly about 2 years old. What do you notice about her so far?
I don't quite sure, doctor.
Not sure. Okay, Atira, anything that you notice?
I think she's a bit shy.
Louder.
I think she's a bit shy.
Sorry?
Shy.
You think she's shy? Why do you think she's shy?
She didn't talk a lot. I mean, she didn't reply in a loud voice to the one who asked her.
Okay, she didn't reply. Zul, anything you notice, Zul Farhan?
I think when the girls ask talk to her, the the kids is not respond to the to the doctor.
Faham tak faham? The face not respond. Dia tak tengok muka. The face not
Yeah,
respond.
macam there's one
Dia
and
tak
dia tak tengok worker doktor tu, macam tak layan doktor tu.
Okay. Macam tak layan. Okay. Now, after this, you guys pay attention to the eye contact, okay? Pay attention to the eye contact, okay? And then towards the end, before I pause the clip, the candidate took the mic and gave it to the mom, right? To another person, right? And then the girl went to the person to get the mic, right? Did she say anything? Did the girl say anything? What did she do? Umaira, what did she do? Did you notice, at the end? When I stopped it.
She wanted to pick it up. She wanted to pick mic, but she didn't ask for it.
What did she do? Dia buat apa?
She ran to it.
No, the mic was with an adult, right? The mic was with an adult, right? She ran to the adult, right? Then what did she do? Tak perasan?
No.
Hannah perasan tak? Dia buat apa? Okay, after this you pay attention to how she asked for the mic. Ask. Come. Okay, come this way.
Doctor, you haven't shared your screen yet.
Yeah, here are.
Shall we sing a song? Come. Okay, come this way. Daniela, come. What have we got here? What have we got here? It's gone. Do you want to show me your nose? Where's your nose? Daniela? Hey, pretty girl. Where's your nose? Can you show me your nose?
At any point, do you see the child looking at another person's face?
No.
Okay. There's Fatin, Najia. So how did she ask for the mic?
I think she like throws a fit to get the mic.
She just jump up and down.
Yes. Without asking properly.
Pulls at the adult, isn't it?
Yes.
Right? She looks like she's 2 years old. Is that what you would expect a 2-year-old to do? Aisha, Zulkarnain. Aisha, is that what you expect a 2-year-old to do?
I think she should at least say at least one to two words that she wants the mic.
She should be able to verbalize, right?
Yes.
Exactly. Verbalize, isn't it, that she wants the mic, right? Like at least look at the person and go mic. This one, she was basically just hopping up and down and pulling at the person, isn't it? Right? Yes. At any point, did she look at anybody, her brother, the person holding the mic, or the candidate? No. Already, isn't it? Right? So there's already a red flag. Right? Even when she is looking around, you notice that she's not looking at a person, she's just looking at the surroundings. So that's another thing to take note of.
All right. Do you think Mummy will come? You pointing at your nose, and where are your eyes? Mum, do you think it'll help if you ask her these questions? Will she answer? Okay. Let's see. What's good girl? And Mum, ask her where her eyes are. Daniela, Mummy's here. That's gonna fall. Would it be okay for me to ask Mum some questions then? Yeah, she seems a bit distracted by the toys. Mum, do you mind if I ask you a few questions? In terms of Daniela, how does she...
Okay, when the kid went to the mom, right, what do you notice? Did anybody notice anything? Nurul, Ain, Amin?
Yes.
What do you know?
She immediately responded to the mom when the mom asked, "Where's the nose?"
Did she immediately respond?
It took time. Only when she's directly in front of the mom, she responded.
So that's not immediate, that's not immediate, right? Okay, and then you guys watch that bit again. Pay attention to one, whether she's actually looking at the mom. If she was looking at the mom, how sustained was it, right? And how sustained the interaction was. Okay.
by the toys. Mum, do you mind if I ask you a few questions? That's gonna fall. Would it be okay for me to ask Mum some questions then? Yeah, she seems a bit... Okay. Let's see. What's good girl? And Mum, ask her where her eyes are. Daniela, Mummy's here. Okay. Let's see. What's good girl? And Mum, ask her where her eyes are. Daniela, Mummy's here.
So that's the interaction with the mom, right? How many of you think that interaction is normal? Put up your hand. Whoever is not having a picture there, whoever is having a picture there, just put up your hand. Who thinks it's normal, a normal interaction? Who thinks it's at normal interaction? Who thinks it's abnormal? You know the next question is going to be what's abnormal about it, isn't it? Suhaib, apa yang tak normal pasal interaksi tu?
She wasn't making eye contact with the mother, and it took her quite some time to actually respond towards towards the mother's question.
Okay, so she did make a very brief eye contact with the mom, right? Very brief, like in the part where she was pointing at nose. The thing about her pointing at nose, you don't know whether she was pointing at nose because she was asked to point at the nose or because it's something that she does, right? Subsequently, asked to point to the eyes already, right? Then she looked at the mom, looked for a mom for a while, then gesturing something, then walked away straight away, right? Now, a normal kid, if they don't get what they want, or if the mom doesn't respond in the way they want, they are persistent, isn't it? True or not? They would stay there until the and engage in the mother or the father or whoever it is, engage in the parent until they get what they want, right? This girl just went, then where's your eye, don't know, then walked away, and then she did something like, sort of kind of looked at the mom for a while, like did something, assuming it looks like she wanted the mom to follow, right? But after that, immediately turned away and then went to play again, right? Now, most normal kids who has little brothers and sisters around their age, 2-3 years old, or little nephews and nieces around their age, you notice that if they want the parent to follow, or they want the parent to look at something or play with them, even if they turn around, they'll still turn back, right? To make sure you follow, right? Did this girl do it? No. And the interaction itself was very, very brief. At any point during the session, did it seem like she was really looking at somebody? The brother was there at the same time, right? Intermittently, you can see the brother looking at the mom, the brother looking at the candidate, right? But you don't see the girl doing it, right? This is why it's called a spectrum. It's not that typical by themselves, langsung tak layan orang. No, it's a spectrum for a reason, isn't it? Right? You have a very, very mild, almost so-called neurotic. I'm using this very lightly, normal, right? Basically, if you don't look for the features, you might not find them, right? You got some people who grow into adulthood and then they are diagnosed. True? That means they somehow learn to cope, right? And then you got somewhere in the middle range where they can function normally, need a little bit of push, need a little bit of help, a little bit socially awkward, right? Then you got the ones at the extreme, right? That is the ones where people you always read about, you always watch about, but it's not necessarily what you might see in the general population. You get what I mean? Right? So let's just continue with the thing. This will be the last one. No! Wrong one.
That's gonna fall. Would it be okay for me to ask Mum some questions then? Yeah, she seems a bit distracted by the toys. Mum, do you mind if I ask you a few questions? In terms of Daniela, how does she, can she vocalize, can she speak to you?
Gradually, yeah.
Yeah? What sort of stuff does she say?
Just one word. Yeah.
One word?
Yeah,
Okay, so she can say come, go, things like that. Okay, one word. And I saw when you asked her about the nose, she pointed at her nose. Can she point to different body parts as well? Not all. Okay, just a few. And
sometimes when you sing,
she sings with you. Okay, good.
Hands, shoulder, knees, and toes.
Oh, she can do that. We can try and do that in a bit. And does she understand if I showed her the duck? Would she be able to tell me it's a duck?
Not duck, but she can say quack.
Oh, okay, so she understands what it is. Okay, fine, good. And what language do you speak at home? English?
English and sometimes Yoruba.
Okay, fine, all right. And she seems to understand both quite well, and she can sort of say a few words. Okay, good. And any concerns about her hearing at all? No, she's passed her hearing test so far. Good. And she does seem to be quite chatty right now. Should we try and see if she sings? Daniela, should we sing Baba Black Sheep? Yeah? Do you want Mummy to start?
Say Baba.
Have you any wool? Yes, sir, 3 bags full. She doesn't seem interested right now. Okay. All right, that was really good. That's fine.
No worries. Thank you very much, Mum. I think there was a lot of stuff that she was more interested in than me. Thank you. So I did a speech and language assessment on Daniela in terms of developmental age. She's awake, she's alert, she seems to be quite curious about what's going on in her surroundings. She wasn't very interested in talking to me, but when Mum asked her questions about where's your nose, she could point at it, which shows understanding. Good understanding. Mum says she does say one-word sentences such as come, go, and she does seem to understand. Mum also said if I showed her the duck, she would say quack. So she seems to understand what nouns or what an object represents, and she does also sing as well. So putting all this together, I feel that she, and I did actually hear her try and babble a little bit or talk a little bit. So putting all this together, I'd give her a developmental age in terms of speech and language at 18 months.
Okay. Yeah. And her chronological age is 18 months.
Okay, yeah.
So what would you tell her, Mum?
So I would reassure Mum, at least in terms of speech, that she's absolutely on track with where she is, with where she's meant to be, and I wouldn't worry about it.
Thank you.
No problem.
Huh. You've heard the way she presented, but because she's just assessing the speech and language and nothing else, and it doesn't mean that her answer was correct. Okay, but you've seen even if she's 18 months, the fact that a lot of the history is a lot of the examination findings is taken based on history, right? So in a real situation, let's say if you saw this patient in the clinic and you're already the doctor, right? What you would do is that you would make another appointment to see the patient again, right? Even if, let's just say this child had gone to see a developmental pediatrician, a diagnosis wouldn't be made at the first visit, right? Let's just say, if I look at this child, but she's 18 months long, if I look at this child, to me there's cause of concern because she is very, very distracted. There's barely any interaction, right? Speech-wise, did you guys hear anything? No, isn't it? The mom says she can say come, go, but even then at 18 months, come, go is just 2 words, right? You expect more than 5 words, right? If the child were to see a developmental pediatrician you see for one visit is about 2-3 hours. It's not a 10-minute visit. You see, a developmental pediatrician is a pediatrician who specializes in developmental pediatrics. That means they see the children who have ADHD, who's on the spectrum, any child who's delayed in whatever way, right? So those are they will see like for 2 hours, and then after that they might give another appointment again, and then they see again. But in between, if the child is delayed in any manner, you would immediately start early intervention. So you get a proper hearing assessment. For this child, it's concerning because one, eye contact, not so great. Social interaction, not so great as well. Speech-wise, she is rather at the lower end of 12 months rather than 18 months, right? Because 6 months is a very big gap. So in between, if you ever see a child with delayed speech, always make sure that hearing is okay. So always refer to the for a formal hearing assessment, right? Even though the parents say they don't think hearing is a problem, you might not know, right? You still need to refer for hearing assessment. In between, get the child to see a speech therapist, right? If the child is just slow in talking, seeing a speech therapist won't hurt, right? But if the child is actually having other problems such as being on the autism spectrum, seeing a speech therapist early will improve outcome. True or not? Right? The only person who's suffering would be the speech therapist having extra work lah, but that's their job, isn't it? Right? So whenever you see somebody with speech delay, just refer to the speech therapist. Don't even if you think it's something that the child will grow out of, meaning you think the child is normal, right? Just delayed speech. The extra speech therapy doesn't help, right? And it actually helps a little bit. That's what I mean lah. Because it's better for you to provide therapy to everyone than to miss out somebody just because you think they get better by themselves, right? Okay, so it's already 1.5 hours enough already lah. More than 1 hour you really cannot tahan. Anything that you guys want to ask? There's a video. Wait, I'll put the link in the chat. You can watch, but some of the things are about how to remember milestones. But some of the things lari a bit from your protocol. So the things that doesn't tally with your protocol, you just ubah a bit. Okay? It's just a video on how to memorize developmental milestones. Let me just get the link.
Precisely, these reflexes are supposed to disappear, but I will be presenting them in a way that's easiest to remember. There are 4 reflexes all medical students should know, and engage in cooperative play, which is kind of
So I put the link in the chat. I mean, it's quite cute lah. Nice. It's 5 minutes. Just watch me in between your music videos. Okay. So it's just 5 minutes. It's just something cute for you to watch, so that you can remember your developmental milestones a bit better. Okay. There's another one, but this one really is off. The milestones are a bit off. Not the link that I gave you. There's another one, but that one I think better not. Because the other one, the milestones are quite off it. You guys get confused. But this one is quite okay. It's just a 5-minute cute little video. Just watch me. Okay? So if that's all, then I don't have any more classes for you guys this week, right? Ada lagi ke tak ada?
Doctor, I have a question.
Yep.
So regarding the red flags, how do you differentiate between plateauing and regression, or is it the same thing?
No, you have to plot the. You know what's a plateau, right? Do you know what's a plateau? Yes, a plateau means status quo, right? This would be a plateau. This would be a regression. A plateau means you gain skills, and then you never get better. You gain skills and then you never gain more skills, right? You're stuck at that level. A regression means that you gain skills and then you lose them, right? So can walk, can run, cannot run, stop walking, lie down all the time. So that's a regression, right? Plateau, can talk, learning words, understand yes or no, can talk, can answer in single words, never learn to make sentences, right? Unable to understand complex commands. So you're stuck there, right? So somebody who's regressing is usually a neurodevelopmental problem or spectrum lah, right? A lot of the stories of a person with autism would be they were able to talk, the gaining speech until they were about 18 months old, and then they started regressing, started being very quiet, they lost their words, right? Then you got things which later on when you read your PEDS, then you got IEMs, inborn error of metabolism, you got storage disorders, right? So they gain They gain skills, and then after that they lose their skills, so they go back down. So usually those are the ones that what the easiest one would be can walk, can run, then cannot walk, cannot run. Right? They lose their motor skills. Right? So that's the difference.
Yes, doctor. Thank you.
Any other questions?
Doctor.
Asma dulu ke Ami dulu?
Ami ya. Hello. Doctor. I don't know if this question relevant or not, but since we have fine motor and gross motor development, is there any sensory development?
We don't assess sensation in that manner. No, we don't assess sensation in that manner.
Oh, okay. So there's only motor.
Motor and fine motor. How are you going to assess sensation? Sensation is more of when you do a neurological examination, right? Whether the child can feel on this part, whether the child can feel this part. There's no such thing as can feel heat, cannot feel. You can feel heat first, then you can feel cold, then only you can feel pain. No, those things are ingrown, isn't it? Right? You are born being able to feel pain. You are born being able to feel cold. You are born being able to feel heat, right? But there is a thing called sensory processing disorder, which is linked with autism. But that's a different manner. Those are the kids who have problems dealing with the senses. So there are kids who have problems dealing with loud noises. There are kids who have problems dealing with icky, sticky things. There are problems with kids who needs a lot of physical stimulation in order to concentrate, right? All these things, as you grow older and your neural synapses mature, connection matures, you get better at it. That's why when you notice some toddlers don't like going on the sand, right, at the beach. Gradually, once you expose them to it, then they get more used to it, then after a while they couldn't be bothered, right? So that's sensation, right? But there's no way you can assess it formally, and there's no progression of it. You get what I mean? It's basically, if the child has a problem with sensory processing, it's basically a desensitized. You treat it by desensitizing the child through repeated exposures, right?
Okay, thank you, Doctor. Doctor, I have 3 questions. First, this assessment, should it be a routine, or usually parents only bring the child when they had any suspicion? Is it a routine for this assessment? Is this assessment a routine?
All the nurses, you know that the nurses, the clinic kesihatan, they are supposed to visit every baby, right? That is born, right? And then they are supposed to, during immunization also, they are supposed to also assess the child. Basically, these children are supposed to be assessed by either the nurses, the clinic kesihatan doctor, or incidentally during a follow-up for whatever problems the child has. The child is supposed to be assessed developmentally anyway. Get what I mean? But as a routine, during immunization, during the first few years of life, the nurses is supposed to watch out for kids who are delayed, right?
Second question, Doctor. If the development is delayed, we do intervention. But if the development is more advanced than the expected age, is it okay?
Iya aja lah. Kalau advance dia aja lah. I mean, what will it cause problem? What do you mean by advance? I mean, if the kid can walk at nine months old, doesn't matter, right? If the kid is genius, cognitively is a genius, very, very high IQ, so it doesn't matter, but it's just important that the child gets support so that the child doesn't get bored and he reaches his potential, isn't it? If you're talking about whether the child is smart or not, right? But otherwise, it doesn't matter if the child is so-called advanced. Now, whatever guidelines you get, 6 months must do this, 9 months must do this, it's not to the dot, it's always arranged, right? It's not like the 6 months old, definitely can sit already. No, it's all arranged. But there is an upper limit of which they cannot pass without getting an without being assessed by a pediatrician, like walking. Definitely, if not walking by 18 months, definitely needs to see a doctor, right? Definitely needs to. If not, don't have two word phrases by 2 years old, definitely needs to get an assessment, right? But if the child is quick, no big deal, isn't it? It's just that the parents have to make sure that the child is supported in terms of intellectual ability, whether they can or not, isn't it? Right? After all, if the child is quick to walk, by the time everybody else reaches 18 months, most of them will be walking anyway, right? So it doesn't make a difference, right? If the child is quick to draw, by the time all these kids go to kindergarten, all of them will be able to draw, right? So it doesn't actually make a difference if the child is quick, isn't it? So if the child is quick, good, keep up the good work. Okay?
Okay, Dr. Last question. Until what age we assess the milestone? Is it maximum 5 years or more?
I mean, if the child is normal lah, up to school going age lah. I mean, first 2 years of life. First 2 years of life, if it seems the trajectory is normal, you really should be okay lah. Usually, if the child is delayed anyway, right, then you're going to follow the child up in the clinic until whenever lah, right? True or not? If the child is delayed. If the child is delayed, it's usually secondary to something, right? So that secondary to something usually will warrant a follow-up anyway, true or not? Right? But if the child is normal up to kindergarten age, then it should be fine. But don't forget, once we go to school, then you have other things like dyslexia. Right? So those are the times when the teacher might tell the parents, hey, your child cannot read, he cannot recognize alphabet. Maybe you should let the doctor see and see whether he has a learning disability. Right? So you get a different set of problems when you're in school.
Yeah, understood. Thank you, Doctor.
Any other question? Tak ada dah. Bye-bye.
Doctor?
Yeah.
I have a question. I just want to reconfirm back. So the easier way to learn and memorize the developmental milestone is by group of developmental milestone, like you have drawn just now. For gross motor, what is expected to happen by 3 months, or rather than we learn by ages of child?
No, if you learn by ages, it's difficult because if you learn by ages, not all children will achieve it at the same time. So it's a variation. What you learn is you learn by area, but you learn progression. So what I mean by progression is that you learn by, first, you need to have head control, right? Then you need to have neck control. Then you need to have truncal control. Then the child sits with a curved back. Then the child sits with a straight back. Then the child sits tripod position unsupported, straight back. Then the child can bear weight, can pull to stand. All this, if you think about it logically, it's just a progression, isn't it? Can pull to stand, and then can stand unsupported, then can start to cruise, can start to walk, can run, can hop 2 feet, can hop 1 feet, can go tricycle, right? So when you learn it that way, you know that walking comes after cruising, right? So if you see a child, and then after you learn it that way, then only you try to stick in the ages, right? So you then you try to stick in, okay, I know walk 18 months, cruise 1 year, sit, tripod 9 months, okay? Then only you stick in the years. So you remember progression first, then only you stick in the years. That way, when you do an assessment, let's just say this child is 3 years old, and he is crawling, right? He's 3 years old and he's crawling. You know, he's 3 years old. He's at least supposed to be running and jumping and hopping, isn't it? So 3 years old, he's crawling. So now you know that you need to go up. So you know he can crawl, right? So you try to get him to stand, right? If he can stand, then you try to get him to walk a few steps, right? But if you see him crawling, you try to get him to stand, then he cannot stand. Then you know that his developmental age for gross motor is only roughly between 9 to 12 months. So he's delayed, right? That's what I mean. It's the same thing progression, like gross motor is easy because all of us have seen kids growing up, isn't it? It's a bit more difficult when you come to things like the drawing thing. So if you remember 2 years old is one line, 3 years old is circle, 4 years old is 3.5 is cross, 4 years old is square. The problem comes when you get a 5-year-old kid and he's drawing circles. And then you're stuck because you remember a circle is 2 years old and then you don't know where to go from there, right? But if you remember that it was a circle, you remember that it's a line, a circle, a cross, a square, a triangle, and a diamond, then you know, then you would know that, okay, fine, he can do that. But you already know he's 5 years old. You can either ask him straight away to do a triangle and work backwards if he cannot, or the better way to do is he can do a circle, right? Can do 3 years old work or not? Can do 3.5 years old work or not? Can do 4-year-old work or not? Then can do 5-year-old work or not? Right? So that is the easier way to do things, rather than haphazardly trying to fill in the blanks, right? Because you are going to see kids who are at different points at different areas. So if you go by age, when they are at different points at different areas, and you already know this fellow's age is there, you're going to get confused, especially in the beginning, because you'll be jumping up and down. So what you do is you learn progression first, then you stick in the ages, then you memorize the important milestones. So that would be 6 months, 12 months, 18 months, 24 months, 3 years, 4 years, 5 years, right? It comes with practice. That is why I told you guys to draw the timeline. When you draw the timeline, first what you do is you learn it this way, right? You learn it this way, right? After that, then you learn it that way. You get what I mean? So this is addition. Like you are learning maths, right? This would be learning 2 plus 2, 2 plus 3, 2 plus 4. Later on only you learn 4 times 5, 5 times 6, 7 times 8. That's what I mean. You get it now? Right? So you learn it this way first. That's easier lah. If not, you're going to remember blindly by age. It's a bit more difficult to memorize. Okay?
Okay, thank you.
Okay, done? 5, 4, 3, 2, 1. Tak ada. Okay. Bye-bye. Dah pukul 11.
Thank you, Doctor.
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 Ina bila? Minggu depan ke minggu lagi satu?
Minggu depan.
Hari apa?
Hari Isnin.
Okay. Kalau nak hantar slide kat saya, hantar hari sebelum. Kalau nak feedback, kalau tak nak feedback, tak payah hantar. Okay, you guys are adults. I'm gonna see you guys as adults. Okay? Okay, bye.
Thank you, Doctor.
Thank you, Doktor.